Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, Stephanie Desmond catches up again with Dr. Emily Oster, a Brown University economist who has been studying COVID and schools. They talk about the latest data informing decisions on opening or closing schools. Let's listen.
Emily Oster, thank you so much for joining me.
Thank you for having me.
We're glad to have you back. We're talking today about schools and why in many places they're not open. I guess I want to start with the big question, which is, are schools super spreader events?
I think the answer to that is no. Certainly, if you ask the question, do schools seem like they will be drivers of community spread? Does it seem like when we open schools, they are places with large outbreaks? I think the answer is no. And I think we now have probably enough months of data to have a good sense of that particularly in younger kids' schools, particularly in elementary schools, maybe middle schools, we're just not seeing big outbreak events. I mean, we're really not seeing any of them, like very, very, very limited. It's hard to even find an example in those cases. In high schools, we're seeing quite low rates. We're not seeing a lot of evidence of a lot of spread in schools. High schools do seem to be slightly more likely to be sort of places where you see, the volleyball team has COVID, sort of things like that. But it's, they have not proven to be the kind of large scale drivers of the pandemic that I think people were at one point really worried about.
Mm-hmm. So here, I live right outside Baltimore, and my son, who's a high school junior, can't go to school, but I could go to a bar until 10 o'clock at night. So that is something that has really been bothering me. And I wanted to talk to you sort of about why we are, from your research and what you've been looking into, why is this happening?
So I think to answer that, it's probably useful to sort of think back to kind of what we thought at the beginning of the pandemic, to like, how do we get to this point? And if you think in general about respiratory illnesses, child-oriented illnesses, if you think about, what happens when you send your kid to school for the first time or to preschool for the first time, they tend to get sick, right? And when your kid has when there's a cold going around the preschool room, everybody gets a cold, or when your kid comes, so you say like your kid comes home and they said, oh, Sophia threw up on the rug, you got to cancel the next 3 days because your kid, then this next kid, then you and your spouse, like everybody's doing it, right?
Yeah.
And so I think when this sort of started, that was very much in our mind about like, okay, this is a respiratory virus. Kids are going to be high risk. Kids are going to get this. Kids are going to be a source of spread. And even when it became pretty clear early on that kids were not themselves getting very sick, there was still this sort of like, kids are these germ vectors. They're going to spread it everywhere. They're going to be like, germ spreader people. And I think that has been very difficult to train ourselves out of. It has just turned out that COVID is not like those things. I don't think we have a great understanding of why, but it is just not. COVID has proved to be much less of a risk in kids, and it does not seem like kids are spreading it to the extent that they seem to spread everything else. And so, but I think it's just been really hard for people to back out of that mentality. So I think that mentality kind of got in a little bit, and it made people sort of think of, school, maybe we all agree schools are really high value, but we also kind of have this instinct that they're going to be high risk. And then over time, as data came out of Europe, as we started to get some information from childcare centers in the summer, from how some camps had gone, even then from how some early schooling had gone, opening in August and in September, it became increasingly clear that in the data that sort of schools were not this like high risk group, but still we were there was, of course, there's some other kinds of resistance, but I think it's just been very hard to train out of the idea that they are not high risk. And while we were doing that, we opened all these other things, and we sort of thought of all these other things as like, okay, those are something we can control. And somehow that left us in a situation where we did not prioritize schools. We sort of have been thinking of them as these like kind of the secondary last thing that we need to do, which is, in my view, is not really appropriate.
Mm-hmm. And I keep, I knew going in, that kids are going to suffer from having to be on virtual learning. And now sort of the reports are sort of catching up to us. I keep reading about how in many states where there's no school, the kids are failing at higher rates. They're not showing up. To me, the fact that we decided kids sort of were expendable in some way, or at least had to be so protected and cloistered in their homes. Now we're seeing the effects academically.
Yeah. I think that, I think we hadn't quite realized how large these effects would be. And there was sort of some discussion of them in the spring, that there were big learning losses. We saw drop-offs in learning and so on. But of course, the spring was a total chaotic nightmare. And so I think there was a feeling among some people over the summer that look, if we do remote learning right, it can be good. It can be kind of almost as good, 80% as good as in-person learning. And the spring, that wasn't very good, but we're going to have better systems in the fall. And I think that what has happened over the course of the fall is we've realized that that's not true. And I think it's sort of not true in kind of two different ways. One is just for people families with more limited resources, this has proven to be completely disastrous. Like, kids are not logging on. They're just they don't have good internet access. Nobody's there to supervise them. There's just tons of really bad stuff going on. But even for people with more resources, I think it has just turned out that actually your 9-year-old shouldn't really be on Zoom for 9 hours a day. It's actually really hard to have, in person to replicate what you're getting out of in-person school, either on the learning side or maybe even as or more important for younger kids on the socio-emotional side. I think we're seeing really high rates of mental health issues in kids basically at all ages. So when I talk to people who work in the ED, in the emergency department, they're saying, we're seeing higher suicide rates in kids, or suicide attempt rates. We're seeing a lot of depression, anxiety, things that seem clearly to be related to this kind of the fact that their lives have been really disrupted. So I think we have started to get that sense that, in fact, the costs of this are much larger for children than we had anticipated that they would be. And I don't know how predictable that was, but I think that's turned out to be something we've learned, more in the last few weeks even than we had.
How are we going to get out of this? Because so when they canceled, for example, the public school where my son goes, when they canceled in-person learning, they did it till the end of January. End of January we could be really in the throes of something even worse than we are in now. How are we going to rationalize going back to school then?
So I think there's sort of a couple of things. So I think one is that places very slowly started to turn the corner into kind of trying to think about spread in schools as the problem, as opposed to community rates. So we were sort of framing a lot of the kind of, can schools be open, as, is there a problem in the community? And I think slowly people have started realizing, well, actually, if schools themselves are not the source of a lot of spread, then really what we should be paying attention to is, are we seeing issues in schools? Not, are we seeing issues outside in the community? You saw this most saliently in New York, where they had sort of written this rule that, de Blasio had written this rule, schools close at 3% community rate. He then had to implement that. And a lot of people, actually, including the teachers union, were like, wait a minute, actually, we haven't seen a lot of COVID in schools. This is sort of insane. And he has now walked back on that. He has now gone in sort of the other direction, said they're going to open all elementary schools full time for everybody who is sort of signed up. And then they're going to think about closures as a result of kind of kids, sort of what is happening inside the school. So I think, one thing is, if we can move in that direction, I think it will help. But I have to be honest. I think that the thing that ultimately is going to get us out is the vaccine. And people have talked about where teachers need to fall in the vaccine list. And I think the answer is they need to fall, teachers and other school personnel probably need to fall pretty early on in that, because I think that may be the key to getting schools to reopen. And maybe that's what it's going to take.
Mm-hmm. Well, I think it's interesting too, because, for example, there's a lot of pushback from teachers at schools where they haven't opened yet. So I don't know I guess you said that in New York, we've gotten around that at this point. I'm just trying to get my mind around, there's a whole group of people who are saying, we still don't feel safe.
Yeah. Yeah. And I think I think part of what we have seen is that it is these first openings, the opening moment is the hardest.
Yeah.
Right. And we saw that in a lot of places. I said this in the summer. I was like, you have to open now. Like, it's like now or not now. And people were like, what are you talking about? We're going to see how it goes. We did a few weeks. But the truth is that then people got into November and then they were like, oh, well, let's open now. Well, now is a lot worse than it was in September in most places. But I think it is also the case that it's very anxiety provoking and scary. And it seems really weird. Right. So one of the things we've seen a lot of people say is well, school's not really going to be regular. All the kids will be wearing masks. There'll be plexiglass. They'll be emotionally scarred from the masking. I think what happened as schools open, particularly for little kids, they were like, no way the 5-year-olds can wear masks and be behind plexiglass. Then these schools open and it was actually like, oh, it's no problem for 5-year-olds to wear masks. They have no problem doing that. Aaron Carroll made what I thought was a very good point in some piece recently, which was they don't want to wear pants either. But they're doing that, it's they're doing the pants. And so I don't know why we didn't trust them. And I think it has turned out for places that opened, both teachers are less afraid than they were, that you sort of get used to it. And you realize it's going okay. And you see the value for kids that even with the masks and the plexiglass and the distance desks and whatever, the kids really like to be around other kids. Right. And that there is just huge benefits to that. And so I think part of this is if we could just push people to try, I think that it would be easier. I think that's what's helping in New York is that people went back, they saw it went fine. Now they're more willing to go back again.
Now, Europe has prioritized schools. A coworker of mine lives in Geneva. The whole city was basically locked down, but her kids' schools were open.
Yeah.
So, what can we learn from them?
I think that one thing we learn is, I think this has illustrated for me the fact that we generally don't prioritize schools. So people have pointed out that it's not like COVID is the first time that we didn't put schools first. Schools are, underfunded. Teachers are buying their own supplies, so their kids have markers. And then they looked, okay, let's do the ventilation. Let's improve ventilation in schools. It turns out to be something people really care about with COVID. Oh, well, unfortunately, this building is already, all of our buildings are below code anyway. They were supposed to have 3 air circulations. They have 0 air circulation. You can't open the windows because of some other. So it's I think this has sort of brought out a difference that has always been true for us versus Europe, which is that, we haven't particularly public schools haven't sort of come first. But I think it also illustrates some, sort of deeper things about, how we structure society and how different the approaches in Europe are to these kind of questions.
Mm-hmm. And I think, we talked a little about the have and have nots in terms of internet access and support, but, the other thing is private schools. So private schools are open for the most part. And where I live, public schools are closed. I happen to be, full disclosure, I have one kid at public school and one kid was transferred basically to private school because of social and learning issues based on the spring. And so my daughter goes to school and my son is on Zoom. So, and that's just in my own house. So then I think you sort of extrapolate it to the country. It feels like this divide is going to keep growing.
Yeah, I think the sort of inequality implications of this are going to grow, are going to keep growing. And, we've seen people have sort of taken this as, oh, well, private schools are open because they have a lot of resources. But, I'm not sure that's the whole answer, because, a lot of the archdioceses have been open, and that's a very similar population to the district public schools. And, they've been open, I think, a lot in person, and basically it's going pretty well. So, I think that there is, that is a way to illustrate that things can happen, but it is also like a huge inequality driver. I think one of the, so I live in Rhode Island. My kids go to private school. They were in private school before, and they are at school full-time in person, but actually here, the district public schools are also in person full time. So actually, our governor has tried to take more of a Europe approach to this, and so actually, we're right now, we've just started what we're referring to as a pause, where there's like no bars, and indoor dining is at really limited capacity, and something about stores. But she actually left K-8 school open and let districts leave their high schools open if they wanted, and so I think that's been good.
Yeah. Well, I really am hoping that the vaccine gets us out of this soon.
Yeah. I mean, I think the other thing that people have mentioned that I think is worth sort of thinking about in the next, really like 3 months. I mean, I think between now and Christmas, stuff is going to happen or not happen. There's not a lot we can do. I think that there's an opportunity to reset in January, and we probably have, January through kind of March to think about before it's likely that there's like widespread vaccination. I do wonder about whether there's a role for more testing, even in just making people feel better and kind of getting them over that hump to like get people back to school for the first time and say, look, how would you feel if we said every week, every teacher will be tested? Every school staff member will be tested. Maybe every high school kid will be tested. I think that's not out of the question with our current kind of capacity, and thinking creatively about some stuff like that, just as a bridge for sort of getting people comfortable, I think would be good, because I worry a little bit that, if it's March or April when there's a vaccine, are people going to think it's not worth it to get back to school for 2 months? I mean, I think it is worth it, and we may need to push school through the summer, honestly, although probably people will complain about that. But I think, we're going to have to figure it out. But.
Emily Oster, thank you so much for joining me.
Thank you for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.